Hi, and welcome to this edition of Standing Orders, a show where we aim to give the EMT and paramedic immediately useful and practical information they can use in their daily practice of medicine. There was a time when EMS providers would give massive quantities of IV fluids or crystalloid infusion to victims of trauma who had lost a lot of blood, maybe even be hypotensive. In fact, by the time the crew got to the local ER, the patient's blood pressure would often be normal, maybe even a little high, and they were proud of it, and rightly so, since medical practice at the time seemed to support and believe that raising or normalizing low blood pressure in victims of trauma was the right thing to do. But like so many pillars of modern trauma management, we have learned so much from our colleagues in the military. We now know from battlefield data that normalizing blood pressure may in fact not be the right thing to do for our patients. Acidosis, hypothermia, and coagulopathy are often referred to as the lethal trauma triad. Acidosis is a result of diminished tissue perfusion. And of course, when that happens, you begin developing hypoxia at the cellular level, which is the definition of shock. Hypoxia in the cells leads to the production of lactic acid, contributing to acidosis, which can begin to occur fairly quickly in a bad trauma patient. So now you take this patient and you begin infusing massive quantities of IV fluids or crystalloid. Think about what's happening. IV fluids have no oxygen carrying capacity. This can actually contribute, therefore, to the hypoxia at the cellular level that we talked about, which of course worsens acidosis. And also, massive quantities of IV fluids are typically not warmed up to body temperature. So now your trauma patient is beginning to be hypothermic or having a decreased core body temperature, which actually can begin to worsen coagulopathy. Coagulopathy referring to the body's diminished ability to form and maintain clots. So this is often referred to as dilutional coagulopathy, as massive quantities of IV fluid can begin to dilute the body's natural clotting factors. So do you see a theme beginning here? Massive quantities of indiscriminate amounts of IV fluids can actually worsen the lethal trauma triad of acidosis, hypothermia, and coagulopathy. During the first Gulf War, up to 25% of the soldiers died as a result of their injuries, as opposed to about 10% or so in Iraq and Afghanistan since 2003. Much of this success in improved trauma survivability comes from the implementation of a concept called damage control resuscitation, or DCR. DCR consists of three things basically: focused surgery, blood products early on, and permissive hypotension. Now, of course, in civilian EMS, there's not a whole lot we can do in the back of an ambulance probably for focused surgery or the administration of blood. But permissive hypotension is something that we can do. It's a concept that's easily understood, and if applied properly, may actually help our civilian victims of trauma improve their survivability. Permissive hypotension is often called balanced resuscitation, or sometimes even hypotensive resuscitation. And the concept is simple, really. Limit the amount of IV fluids, or even outright defer IV fluids in a trauma patient as long as they have a good radial pulse. And you limit fluids until you control the resuscitation. If your patient does require some fluids, then you give just enough to maintain a radial pulse, and another strategy is just enough fluids to maintain an adequate mental status. There is one important contraindication to permissive hypotension, and that is head injury. The belief is that head injury patients need improved perfusion of their brain. So if your patient also has an obvious head injury, then permissive hypotension may or may not be appropriate for them. But talk to your medical director about various scenarios. By avoiding massive IV crystalloid infusion, especially in our penetrating trauma patients, we may begin to avoid contributing to the development of the lethal trauma triad of acidosis, hypothermia, and dilutional coagulopathy. We might even begin to stop disrupting the clots that have already formed in our trauma patient. Balanced resuscitation is part of an overall trauma management strategy that, if applied properly, may actually help save a life. Thanks for watching. Be sure to note your local protocols and standing orders. I'm Dr. David Tan. Be safe out there and see you next time.